Some of the dietary interventions or diet interventions that we want people with PKD to think about are similar to people with kidney disease that don't have PKD. So we're looking at again, plant focus. We want to make sure that it's that potential renal acid load, which we have other episodes on, but that it's a more alkaline producing diet, getting more vegetables in the diet, more fiber, whole plant foods. All of that's very important. And then some other specifics, which Dr. Hashmi had addressed, was the importance of low sodium, less than 2,000 milligrams a day. We want to make sure that people are, well hydrated, preventing dehydration, and we'll go more into that. But that's, generally at least 3 liters a day or around 100 ounces a day. Those are kind of usually the things that you'll see on some of the PKD Foundation websites as far as, what to eat when you Google, what to eat with PKD. And then Dr. Hashmi had also brought up that there is, new and emerging research on inducing ketosis and how that can help to either slow or prevent the cyst formation or growth, or potentially even, shrink it or help there be less fibrosis and things like that. And so, as Dr. Hashmi had mentioned, in order to get into that state of ketosis, then there's those 3 options. So there's the ketogenic diet, there's the beta hydroxybutyrate or the BHB supplement, and then there's also like an intermittent fasting or time restricted feeding that can be done. One of the very important things with this is that we still want to have a plant-focused ketogenic diet. And I can't highlight that enough. A lot of times the ketogenic diet, it's heavy in animal products and animal fats, and sometimes can be very high in protein. And protein restriction is still something that, as kidney disease progresses with polycystic kidney disease, the protein restriction still comes into play, and the plant proteins over the animal proteins are still beneficial. And so for a more plant-focused ketogenic diet, we are looking at more of those plant fats, healthier fats, some of those nuts and seeds and avocado. And again, things like potassium are going to be restricted based on individual labs. So that might be relevant to someone. It might not be relevant to someone. But you're, working on getting in more vegetables, plant fats, and then utilizing some oils like extra virgin olive oil, avocado oil. That way you're getting more of the higher fat, lower carbohydrate diet. If oftentimes what I see, and especially with renal dietitians that are working with people with polycystic kidney disease, a plant focus might include some animal products, and usually that would be coming from something like eggs or maybe yogurt over, of course, your red meats or processed meats or other types of meat. So that's kind of what we would be looking at. It's kind of just adding, I think with PKD, oftentimes it's like we have kidney disease and we're adding these other layers of potentially ketosis and potentially lower oxalate, and do they have stones, and the hydration and low sodium. And so I really, really suggest that people work with a specialized renal dietitian to help them see how that works into a typical day based on their needs and where they fall. But those are some of those extra considerations for someone with polycystic kidney disease and their diet that oftentimes don't come into play with kidney disease.